All right, so to draw an ABG, first I'm going to get all my equipment. I'm going to grab an ABG kit and patient labels. In my ABG kit, I'm going to have sterile gauze, an alcohol wipe, a biohazard bag, a point lock system, a syringe and needle, and a cap. So once I have all my equipment, I'm going to verify the order in the chart. I'm also going to look for any recent vent or FiO2 changes to make sure that if they have an air trapping disease, I want to wait 25 minutes. If not, I only have to wait 10 if I want the ABG to reflect those changes. I'm also going to look in their chart for any history of wrist trauma or any coagulopathy by looking at their coag panels like the PT, the PTT, INR, and platelet count, and if they're on any blood thinners. Once I've finished my chart review, I can wash my hands in non-sterile gloves. Then I'm ready to go into the patient's room, introduce myself as a respiratory therapy student, and confirm the right patient and inform them that I'm there to draw some blood today. Once I've done all that, I'm ready to decide which wrist I'm going to draw from. I'm going to feel both radial pulses. Whichever one is stronger, I'll choose that one. If they're equal, I will choose their non-dominant hand. I will then perform a modified Allen's test to make sure that they have adequate perfusion. And I will scrub the site with an alcohol wipe, let that dry, and then I am going to aspirate 1 milliliter into the syringe and get my sterile gauze ready for when the needle is out. Then I am going to palpate until I know exactly where that artery is. I will place the syringe with the bevel side up at a 45 to 60 degree angle against the flow of blood. Right before I stick, I will let the patient know that they are about to feel a stick, and I will stick. As I see that flow of blood, I will hold still. Once my syringe is full, you can stop. I will remove and apply pressure for 5 minutes. After 5 minutes is, oh my gosh, after 5 minutes is up, I will check and make sure they are no longer bleeding. I am then ready. I will then put the needle in there, but for the case of this, I will take off the needle and put on the cap. I will flick to move any bubbles to the top and inject them into the filter. And then I will rock and roll. I will put the patient label on, put it in the bag. That'll be ready to go to the lab. I'm going to assure the patient's comfort, ask them if they need anything, put the call button by them, and then I'm ready to take this to analyze and chart and everything like that.